to my lovely planet Kara, where I have my lovely future doc, Layla, and my lovely future doc, Christine, okay? We're Team CIRS. So we're the weirdos around here that deal with all the cases that get misdiagnosed, unresolved, or not diagnosed at all. We are well known for getting to the bottom of things. So if you or a loved one has a condition that isn't properly diagnosed or falsely diagnosed, you don't get better. You're snowballing, you get more conditions, or everything you're taking only masks what's going on, it never cures it. So if you've been perpetually taking things that even have worked for over a decade, it's not curing anything, okay? We're very into this chronic inflammation response syndrome is your immune system out of control. And this is the early birth, teenage, very juvenile beginning of autoimmunity. So we used to think we don't know what's going on, it's a mistake. Oh, we know. We know what's going on, and we have really, that was so 10 years ago. So we want to do updated medicine. Now, those of you watching this have likely had a positive VCS test. If you haven't, please go back to that video. Make sure you have a confirmed visual exam that you did at home that you sent to us, okay? Once that's positive, step 2 is getting what we call a nasal swab. So Christine will explain how that kind of goes down.
Yeah, so the nasal swab, super simple, quick, easy, 5 minutes to take the test. Okay, you fill out the form and you test for Marcons. Marcons are an antibiotic-resistant staph and streptococci. So you just want to make sure that this is your next step. You'll know what will kill those Marcons that's living in your face.
Very cool, by the way. Cannot get that at your primary. No. Okay, once that is confirmed positive or negative, with the positive VCS test, it's 83 to 90% positive you have CIRS. With a positive Marcon swab, it's like 100%. So then we want to know, okay, you have a fire, you have inflammation in your home. How far did it go? What systems did it get into the blood sugar, the lung, the respiratory? So then we go over in depth, and Layla takes over and really helps us follow through.
So the next step is very important. So we like to fill out a requisition form where you go to LabCorp. You don't have to go to LabCorp. You can go to a lab of your choosing. You are willing to bill insurance. You can use your insurance. The point is, we will write this requisition for you. And it's all the very detrimental blood work that Dr. Kara and all of us as a team require to really find out what systems are just not functioning. Once you go, and you can schedule that appointment at any time, if you go through LabCorp, there's lots of options to choose from. Once you get that visit, you wait between 4, maybe 5 weeks. We get your results. We have this unique portal where we have access to them, and one of us will call you same day we receive them to schedule an appointment with Dr. Kara to review them.
This is very important. I can't emphasize this enough. You cannot take the sheet and send it to your primary. They will order only the labs their lab is capable of. So if you ask them for a test the lab doesn't do, they will only do the ones we will be a whole month behind because they're only going to run half. Again, I'm going to say this again. Patients get very confused. They take this paper. They go to their doctor, say, run these. You're making a dangerous assumption they have the capability of running these specific tests. They do not. They only have certain tests in certain labs because the lab needs to buy equipment and do it and train the people. And if they're not there, they're not going to run the labs we need. Okay? This is very important. I'm going to say it again. It's worth it 3 times. Out of 100 people that have CIRS, 90 do not follow through correctly on it. You have brain inflammation. It's extremely confusing. 90% of your primaries have never seen this blood draw before. So asking them their opinion or Googling it will get you absolutely nowhere, except for more confused. And the more confused people are, the more they quit and they don't get better. So what we're trying to do is make this easy for you, okay? When we mark out the form, we also personalize it. Some of you don't just have CIRS. You have thyroid, you have multiple sclerosis, you have perpetual SIBO or gut, or maybe you've had a surgery. So this is very, very, very important that we get this done right. We need to inspect your home, your body, and figure out every room that has fire in it. Because if a firefighter is going to put a fire out, he needs to go through the whole house. Okay? So proper blood work will be able to track how you're going through the CIRS pyramid treatment protocol.
Which is the next step. So when you've accomplished your nasal swab, we've already gone through the blood work. Part of that follow-up visit with Dr. Kara and following through with the next step is following your CIRS shoemaker protocol to a T. So like Dr. Kara said, there's a large percent of the patients that don't follow through because it seems hard, and because it's hard, we quit early and then we don't get better, we don't get any results. But if you've got your nasal swab test after your VCS test, you get your VCS test, you've got your nasal swab test, you get the blood work done, you follow your shoemaker protocol, then you are on the road to recovery.
Absolutely. It is absolutely super important to understand that you're going to treat your treatment plan that you get after we review the blood work. We have a very clear understanding of where in your body that fire went and what it burned down. So part of your treatment will be to, one, stop the fire. If you do not get out of exposure, we can't proceed, right? We can't rebuild the home when it's still on fire. So some people just want to do whatever they want out of order. You can't bake a cupcake and forget the flour. Bake it and try to put it in afterwards, okay? There is timing and compliance associated with this. So you need to be ready to do step 1, step 2, step 3, step 4, step 5. You cannot have 5 cooks in the kitchen throwing in stuff and put the mutant muffin in the oven and have some weird baby come out. That happens a lot. It happens so often, you guys. You have your favorite acupuncturist, they give you something. You have your favorite DC, they give you something. Your primary gives you med, they give you something. That's a nightmare. That is not a recipe. That does not turn out well. So in a CIRS situation, you need a doctor who watches you. One leader, one doctor. You're going to have to pick who that is. You follow the protocol, you do step by step, and when you do, there's 100% success rate. I'm going to say that again. 100% success rate. That's freaking awesome. That is a hands down guaranteed A+. Every student be in class taking that class if they heard that, okay? So when you have a confirmed chronic inflammation response syndrome and we get people through the pyramid, we succeed 100% of the time. Do you see how excited she looks? Do you see how excited she looks? Do you see how this old woman over here gets to stay young and stay in practice and not get burned out? We've had experience with CIRS, all of us. We're very, I hate the word passionate, it actually means to suffer, but we're very inspired about this because we've been low energy. And we aren't really old, are we? But man, did we feel 80 at such a young age. So it's been really fun to conquer this, get better, have energy, have libido, have zest for life, be able to eat without pain or get exhausted and need a nap after lunch. None of that stuff's normal. Chronic sinuses that need Zyrtec and Benadryl, you don't have a Benadryl deficiency. Okay, that's not a diagnosis. So some of the stuff that you get in Western medicine is a label. It's not a diagnosis, and they give you something to treat the label. We want to get to the bottom of the inflammation, put out the fire, walk you through the steps. All you have to do is not quit. It's pretty freaking exciting. We love it. Now, we redo the blood work and follow through after we also meet about your source of exposure. Your exposure could have been a brown recluse. It could be cat litter box disease. It could be a brown spider bite. It could be seafood poisoning. It could be algae bloom from a lake. You could be an outdoors person. It could be protozoa infections. It can be Lyme disease. A lot of people know about this, so this is very, very important. If it is your home, it's very serious. We have another test through envirobiomics.com. I actually prefer you go to their website and purchase the test yourself. Test number 7 has 3 tests in it. So you're going to get 3 Swiffer packages. 1 test for sewer endotoxin. Endotoxins are waste from things that make you sick, including your septic lines and your city sewer. This also means not stuff you can inhale, or this is undetectable in the air, in the dust settling, okay? The next test is actinomyces, which is a bacteria that feeds on mold. Actinomyces is detectable by nose. It smells musty. Now, that's in excruciatingly 100% beyond positive cases. If you have a 50% positive, you won't smell anything. It will be undetectable. It has to be extremely large amounts to have that musty smell. Mold, no one can smell mold. Mold has zero smell. I can't tell you how many times people told me they can smell mold in their home. No, you cannot. What you're smelling is actinomyces. That's mold's predator. So yes, mold is likely present in that situation, but what you're actually smelling is actinomyces. It grows on human skin. It can live in your mattress. It can live in your carpet. It can live in those cheap little couches made out of upholstery. It loves to live in there. It's disgusting. So you can clean and take medications, and you could just reinfect yourself every time you go to your safe place. That's awful and debilitating, right? Especially when you don't feel good, because that's the first place you go. The third test is a Hurts Me. That is all the different types of mold. Hurts Me stands for, hey, we're going to take a test and see how many different strains there are. We have Aspergillus, Ketonium, we have Cladosporium. These types of species live in different areas. One's a toilet, one's a shower leak, one's a roof leak. We can kind of trace the likelihood of where this water damage or humidity damage is. And let me tell you, in the Northwest, we have water everywhere. Crawl spaces, sub pumps, terrible roofs, improperly installed windows, bad sewer lines, right? It is crazy. There's fridge lines in your wall. There's sprinkler systems going into the home. There's cracked foundations. Everyone tells me their home seems fine. Of course it seems fine to you, or you would have known. I already know that answer is, I think it's negative. If you're sick and nobody can find the source, it's because you can't see it. One little drop from a toilet ring never picks up, not even on a humidity meter, and it can have an entire level of black mold inside of a drywall where nobody can find out unless it's cut open. I mean, that's the sad truth. This test, you literally wipe the dust, send it in, and that little dust, they can tell you all these little organisms, because it does get through the walls, it does get through the air, it does get through your HVAC, your crawl space, and it will get into your air, you breathe it, and it will land, and we can get a real sample of what's actually ending up in your lungs making you sick. It has been an absolute game changer for people. They have found inappropriate construction. They have found bad roofs, all sorts of things when they could have waited until a major disaster. So it does cost a lot of money, but it also saves a lot of money. Because if these disasters don't get found, they're a much bigger issue. Right? People are usually displaced from their homes when it's that kind of disaster. So to catch things early and to have 100% cure, you're not going to find that anywhere else. Please join us in the CIRS journey. I know it's very hard. There's a very small network here. We try to hang together. We have a little support group, and it's not an enabling camp. What we do is we empower each other by learning, because this is one of these conditions where we have to set healthy boundaries in life, including making a habitable home for yourself. If you want to be an ostrich and stick your head in the ground and pretend it doesn't exist and continue taking all sorts of drugs to mask this, or pretend you have allergies, if you had allergies, it probably should end up resolving eventually. I mean, look up what allergies are. It's your immune system attacking something. Eventually your immune system learns. Okay, it's not stupid. We were sold up for a long time. That was 20 years ago. We know so much better. It is a fantastic intellectual system that absolutely knows when there's an intruder, and you're just not turning over the rocks to find out who they are. So we are Sherlock Holmes. We're here for you. If you're interested in the group, if you're feeling suicidal, you want to kill your husband or your wife or your kids, you're super overwhelmed, you can't get through work, you're super concerned about dementia, the next test is a neuroquant. So we do a brain MRI that's special. It has a colored interface that will measure inflammation in the brain. And a lot of you know me as a neurospecialist, and pardon me if you don't know us at all. We have lots of pets at the office, but we're very concerned about people, because if it is estimated that 50% of buildings in the Northwest are water damaged, and 30% of the population as of 20 years ago have CIRS, which is a gene mutation that makes your immune system overactive. There's also an emotional history. So we have an emotional quiz that you can take because people have a history of having emotional abuse, physical abuse, or a boundary issue, right? A family member that takes too much from you, expects too much from you. And, these are things people don't talk about. But if you have a boundary breaker in your life, you're setting yourself up for frustration, hormonal imbalances, which can trigger the gene and create a doorway for you to be one of those 30%. So I truly believe we're a unique team that looks at the mind, the body, the soul. We've got the science down to a T. We've got the testing abilities. By the time we get the nasal swab, the VCS test, the blood work of all your systems, and the systems are insane. We have to do a whole nother video on that, so please check out the biotoxin pathway. We're going to be discussing how this fire travels through your house and how chronic inflammation response syndrome could be actually 7 different diagnoses with 7 different doctors who don't know the source, which is actually CIRS. So please watch that video. Don't be discouraged. If you're really, really struggling, please reach out and email us. We'll get you in touch with the CIRS group. We're having a volunteer come meet in my classroom as I'm going to be hosting in a CIRS safe place for us to go over and learn about this together. Because if you know it and you make one step forward, we don't feel that futility. And we don't have the probabilities of failing go up because we're so overwhelmed. If we do this together, the 30% in the 50% of damaged buildings is 80% of situations. I think CIRS deserves to be taken seriously. And I think we deserve to feel good and have a life and not be overwhelmed. And people that have been through the protocol, that have had 100% success, feel 20 years younger. I don't know a human that isn't willing to make the steps that we ask to get to that place. It's pretty awesome, and even for the price.
Yep.
Does insurance cover things? Absolutely not. They don't cover what works. You can pin the donkey, you can pin the tail on the donkey. I'm just going to come out and say it. They don't cover this. They don't cover the vision test. They don't cover the nasal swab. Let me tell you, the only thing they're going to cover is through LabCorp, a lot of the blood draw. The rest you really need to do on your own. Part of the problem and part of why we are here today is insurance wants to save money, not pay your bills. And so they don't run the tests that we need to find out. And the next thing we hear is, why does my doctor not know about this? Because you bought insurance who tells the doctor what to do. And insurance tells them not to do this, to not find it. That's why. So we had to do things that insurance doesn't cover. And if you want real answers, it's a route we're going to have to go. Luckily, we have spent a lot of time negotiating the rates down for you. And of all the certified CIRS practitioners in the US, we are the most reasonable. And we do that because of a team. I couldn't do it without these gals. So please, if you think you have CIRS, or if you have some positive tests, understand that that's 83% positive. Please don't ignore this. We're here for you. If you're overwhelmed, take it one step at a time. If it takes you 5 years to get better and you don't get it done in one, who cares? At least you got there. A lot of people are out there dying from this. It just took 30 years. It didn't have the decency to kill you in a year to 10 years like cancer, right? So terrible, slow, painful death. I would really, really like to be in a world where people feel good.